Hello, thank you for joining. Today I want to talk about learning clinical data in the cloud. I'm going to be sharing my PowerPoint. My name is Melinda Jenkins. I'm a nurse practitioner, associate professor at Rutgers School of Nursing. I'm the director of the Nursing Informatics program and the course director of the course that I'll be talking about. Objectives today are to explore the learning potential of a user-friendly clinical data warehouse, analyze the value of online collaboration across universities, and evaluate the quality of data in a real-world clinical data warehouse. In our course, we are using anonymized clinical data. Project NIL stands for Nurses Electronic Learning Laboratory. It's developed at Emory School of Nursing. It's user-friendly. It's an online database of actual patients and includes over 2 million patients now. Randomly selected electronic health records with a user-friendly interface for point-and-click search. It's used in Emory nursing courses, and it's used now in our Rutgers Doctor of Nursing Practice Information Technology course. There's also a comprehensive data dictionary included, data analysis and visualization tools, interactive learning modules, and a video library. Our Rutgers course includes documentation standards, data query process, quality measures, Excel analysis and visualization of data, leadership topics, emerging technologies, population and consumer health informatics. So focusing on the Project NIL database, we are early adopters. Students pay a nominal fee and sign a sublicense agreement to have 1 year of unlimited access. In the cloud, they have a logon that they can access through their computers. They have assignments, including checking data elements and quality measures in Project NIL and also in online CMS Care Compare data, selecting an electronic clinical quality measure. These are developed nationally. Finding a numerator and denominator in the Project NIL database tables, and defining a query to capture and calculate each measure. For example, calculating electronic clinical quality measure CMS 2V12, screening for depression and follow-up plan, demonstrates the need to document the numerator with a standardized and validated depression screening tool, such as patient health questionnaire, and the need to see that documentation in the electronic record. This also creates a potential for decision support within the EHR electronic health record. Students will design and implement queries based on a clinical question or quality measure related to their specialty, and they analyze the Project NIL data, present evidence-based recommendations for how to improve the quality of care. They learn that concise nursing documentation feeding the big data in electronic health records will change the way nursing care is measured and valued. Here's a screenshot just to show you how the query is set up online. And here's a screenshot to show you table view of query results. There could also be a graph review. I'll show them in a minute. Data query example using Project Now. So a small group of students worked on this. What proportion of patients age 65 and older were prescribed at least one medication from high-risk drug class as defined by established safety guidelines? So this is equality measure CMS 156V12. The students followed this query pathway, added a table, downloaded data into Excel, where they were able to manipulate the data, merge tables. So here is a graph of what they came up with for 3 years. And you could see that they could actually graph individual medications. These are the steps they followed to clean the data. Out of over 5,000 records, there were only 363 unique patient IDs, which then determined the true number of patients. And they were able to look at 2 categories of medications that are high risk for this age group and develop the numerator and denominator. And once they had their Excel data, they were able to exclude certain patients, younger or duplicate records, or filter out other meds. So here are the results. Patients between the years 2017 to 2019 within the database, there were 363 out of 1,000. So 36% of patients aged 65 and older were prescribed at least one medication from high-risk drug class. This, of course, is higher than the baseline and higher than we want. But it's an example of these skills that nurses need to learn the use of information and communications technology to gather data, create information, and generate knowledge to deliver safe, high quality, and efficient healthcare services. This is from our National American Association of Colleges of Nursing. They have developed and published core competencies for nursing education, basic and advanced. Since nurses collect and record much of the data in electronic health records, this is an important lesson. The Project Nil data demonstrates the need for data quality and for secondary use of the data and sharing in care coordination, quality assessment, artificial intelligence, nursing research, and value-based payment rewards. Some references here, and my email is my name, melinda.jenkins@rutgers.edu. Please contact me with any questions. Thank you.